Hello, this is Scott Ritchie, and today I will be discussing the differences between volume control ventilation, pressure control ventilation, and adaptive pressure control ventilation in regards to improving pulmonary mechanics. How do these modes react when I have a decrease in resistance or an increase in compliance? Well, I'm going to show you that in this following video. This is my mathematical model of volume control ventilation for a patient whose resistance decreases. So I set up my patient parameters. We'll see on the left side of the screen here. And these are my patient parameters. So I've input the patient parameters like a patient with COPD. And we have a good compliance. However, my resistance is very high. So this would be an example of a patient that's having a bronchospasm and the resistance goes up. As you notice, my ventilated variables, I have, if they were delivering 700 cc's with a flow rate of 45, a PEEP of 5. And these are my measured values and my graphs on the right side of the screen. If we look at my pressure, my peak pressure is approximately 30 centimeters of water. So it's actually 29 centimeters of water here. And then based on my pause time, it creates a plateau. And my plateau is actually only about 14 centimeters of water. So as you notice this big gap here, but difference between my peak and plateau pressure. So we know this most of the pressure is related to resistance instead of a compliance issue. And my tidal volume's remaining constant in volume control. So volume control, when this resistance changes, my volume is going to remain constant. And we're going to look at the measured values and see what happens. So I'm going to decrease my resistance to 10. Say that we gave the patient a bronchodilator treatment and it relieved the airway obstruction and it worked. And let's just change the resistance to kind of a normal resistance with the endotracheal tube, around 10 centimeters of water. What you noticed is that my pressure dramatically dropped when my resistance went down, and now it's only approximately about 21, and my tidal volume stayed constant. So during volume control ventilation, when my resistance decreases, my peak inspiratory pressures decrease also. However, my tidal volume remains constant. This is a mathematical model of pressure control ventilation. And we'll notice my patient parameters here. We set it up for that same patient with COPD with a higher compliance. We put it at 80 and a resistance of 20. So we're seeing what happens when the resistance is decreased. I have my inspiratory pressure set at 14, a PEEP of 5, and an inspiratory time of 1.5 seconds. And as you'll notice, my measured values on the right, based on my graphs, my pressure is constant, and so my peak pressure is around 19 centimeters of water, and my tidal volume is approximately 700. So based on this inspiratory pressure of 14, I'm generating almost 700 cc's. Now what happens, say the resistance gets better, there's less airway obstruction, and I'm just going to decrease this resistance by 10. So we have a resistance of 10 now, pretty much normal airway resistance within the tracheal tube. As you notice, my pressure stayed constant, consistent. However, my tidal volume increased dramatically. So it went up to 700 to close to 1,000. So we had over 200 cc increase. And this is during pressure control ventilation. So in pressure control ventilation, when there's increases in compliance or decreases in resistance, you're going to have increases in your tidal volume. And this increases risk for the patient for hyperventilation and air trapping. Here is my pressure control simulator, ventilator simulator, and here are my settings. As you notice, I have a pressure control of 14 and a rate of 10, and my measured values on the right-hand side. And we're getting about 700 cc's, and I have it set up for a COPD patient. As you notice, my compliance is 85 and my resistance is 21. So we have kind of a high resistance. Now what I'm going to do is I'm just going to decrease the resistance down to 15 centimeters of water, and let's see what this does during pressure controlled ventilation. And we're going to look at our measured values on the left-hand portion of the screen. You notice our peak is still 19. However, we're going to watch the tidal volume. Since we're in pressure control, the peak airway pressure is not going to change at all. However, with the decrease in resistance, we're going to get higher tidal volumes. And as you notice, my tidal volumes are going up, my measured values, and we almost went up by 100 cc's. Now this is an example of, this is actually a patient having laparoscopic surgery, and this is going to show the dramatic change in compliance and what happens during pressure controlled ventilation. So the abdomen is currently inflated at this time, and with the pressure control of 23, my settings are at the bottom of the screen, you notice that we're getting a exhale tidal volume of approximately 600 cc's. So we're looking at my measured values on the top left-hand portion of the screen. You notice they started to change. This is the deflation of my pneumoperitoneum, and I have a dramatic increase in compliance, and I'm going to have quite large tidal volumes now, where it's setting off my alarms, and I'm going to have to turn down my pressure control. This is my ventilator simulator with adaptive pressure control. And here are my settings. I'm going to target a tidal volume of 700. There are my measured values. And I currently have a peak pressure of 19. As you see, I have a COPD patient selected. And what I'm going to do is I'm just going to decrease the resistance. So I'm going to change this from 21 to 15. But let's look at a few things right here. Here's my measured tidal volume right now. There's my set tidal volume. And there's my measured peak inspiratory pressure. That's my pressure waveform. Now I'm just going to change my resistance, change it to 15, and let's see what happens during adaptive pressure controlled ventilation. So I'm going to decrease my resistance. And since it is a pressure-based mode, I'm going to initially start getting higher tidal volumes. So we'll look over here on the left portion of the screen, our measured tidal volumes. And there is some lag between breaths, because it's going to only adjust my breaths 2 centimeters of water between my breaths. So my tidal volume is still going to go up until the ventilator catches up. So as you notice, I have a measured tidal volume of 764, and it's starting to decrease my peak inspiratory pressure. So it's going to do this by 2 centimeters of water per breath. And my measured values are kind of an average of about 3 to 4 breaths, so that's why it's not immediate. If you watch the waveforms, you can see them decrease quicker than the actual measured values. So there's my peak pressure. I went back down by 2 centimeters of water from 19 to 17, trying to reduce that tidal volume. So I still have a higher tidal volume of 799, now 780. So the ventilator is going to look at the measured tidal volume again to see where it wants to set its peak airway pressure. And you notice it decreased the peak airway pressure to 16. And now my measured value is going down to, again,